ahead and do my physical assessment. My name is Jody Lovano. Here is my ID. Okay. Alright, so I'm going to go ahead and begin by knocking on the door and introducing myself to my patient. I'm going to go ahead and introduce myself to my patient. I'll go ahead and let them know what I'll be doing today. I'll be taking your physical assessment today, sir, head to toe. And I will also be assessing your cranial nerves today, okay? I'm going to go ahead and wash my hands, and I'm going to go ahead and gather my equipment and all the necessary supplies needed for this physical assessment. Okay, so after that, I'm going to go ahead and provide privacy to my patient. I'm going to go ahead and close the curtains or close the door, wherever, depending on the location. Then I'm going to go ahead and check identification. So I'm going to go ahead and use two patient identifiers with his first and last name. And then I'm going to go ahead and first and last name and date of birth. Okay, so after getting that, I'm going to go ahead and check my patient's appearance. I'm going to go ahead and assess that. I'll be checking to see how my patient looks. His appearance, is he making eye contact with me? How is his behavior? Is his clothing appropriate to the weather and to the culture? I'll go ahead and check to see if he is oriented to person, place, and time. And then I'm going to go ahead and ask my patient to stand up for me, and for this I'll be assessing his gait. So I'll have my patient stand up for me, and I'll go ahead and ask my patient to walk regularly towards me. And then I'll ask my patient to walk on his tippy toes. And then I'll ask my patient to walk from heel to toe. Okay, good. Okay, and then I'm going to go ahead and ask my patient to walk tippy toe. Tippy toe, yeah. Yeah. Okay, so tippy toe, heel to toe, and that's it. Okay. So now I'm going to go ahead and perform the Romberg test. So for this assessment, I will ask my patient to have his hands next to his side, and I'm going to assess his balance coordination, right? So I'm going to ask my patient to close his eyes. So close your eyes, sir, and I'll be checking for balance. This is for the Romberg test. Okay, good. Then I'm going to go ahead and have my patient to sit down. I'm going to have him sit down, and I'm going to go ahead and assess for pain. So I'll ask my patient, do you have any pain today?
No.
Okay, good. However, if my patient did have pain, I would go ahead and do a PQRS pain scale, pain assessment, a focused pain assessment. Okay, so for that PQRS focus assessment, I would ask, when did the pain start? Can you describe your pain? What makes your pain better? What makes your pain worse? Can you rate your pain 0 to 10? And that would be the focus pain scale assessment. My patient's BMI is a 31, so I'll go ahead and do that. I'll go ahead and calculate that, and it was 31. Okay, so now I'm going to go ahead and assess my patient's scalp. So my patient is wearing a hat, so I'm going to ask my patient to remove the hat so I can inspect the hair. So I will be looking at my patient's hair, checking to see if there's any infestations or any balding or thinning or coarse hair. Patient's hair looks curly and black. There's seems to be no infestation, so I don't have to wear gloves. So I'm going to go ahead and palpate my patient's skull. Okay, there's no bumps or lesions on the skull, which is good. Okay, so moving on, I'm going to go ahead and I'm going to go ahead and assess my patient's eyes, okay? So for the eyes, I'm going to go ahead and assess my patient's, I'll be looking at the color of the sclera, the conjunctiva of the eye, and the eyelids of the eyes. Okay, so there doesn't seem to be any abnormalities. The sclera is white, there's no redness or inflammation. Now I'm going to go ahead and assess cranial nerve number 2, which is optic. Okay, so for optic, I'm going to ask my patient to read a paper across the room. Okay, so can you read that for me, sir?
It is a sunny day outside.
Okay, yes. So he was able to read. Alright, so now I'm going to go ahead and assess cranial nerve number 3 and cranial nerve number 4. Okay, so for cranial nerve number 3, that's ocular motor, okay? And cranial nerve number 4 is trochlear. So for this one, I'm going to go ahead and dim the lights, okay? And for video purposes, I'm not going to dim the lights, but I'm going to go ahead and still perform the test. So for this, assessing cranial nerve number 3, I will be checking a pupillary reaction to light using my pen light. So I'm going to ask my patient, can you go ahead and look straight ahead for me? And I'm going to be looking at the pupil's constriction. Okay? Alright, great. So pupil constriction was added 3, which is good and normal. Now I'm going to go ahead and test for cranial nerve number 4, which is the trochlear. And then for this one, I'm going to go ahead and ask my patient to take a look at the tip of my pen, and then I'm going to ask him to look at an object away. Okay, so go ahead and take a look at the pen, and then away, and then at the pen, and then away. Okay, great. So now I'm going to go ahead and assess my patient's, I'm going to go ahead and assess patient's, his eyes, cranial nerve number 6. So for cranial nerve number 6 is abducens. So for abducens, this assessment, I will go ahead and use the 6 cardio positions. Sorry, my dog. Okay. Alright, so now I'm going to ask my patient to follow the pen light with his eyes without moving his head. Okay? Okay, great. So now I'm going to go ahead and assess for convergence. So for this, I'm going to ask my patient to look at my pen light, and I'm going to go ahead and move it towards his nose. Okay, great. So the eyes were able to cross, and there was no abnormalities to that. Okay, good. Alright, so now I'm going to go ahead and assess my patient's ears. I'm going to go ahead and take a look at my patient's ears. I will be looking to see if there's any wax or anything inside the ears, any foreign bodies. There's no foreign bodies. Okay, on the other ear. Okay, then I'm going to go ahead and palpate the ear as a mastoid process. Okay, now I'm going to go ahead and perform cranial nerve number 8, which is acoustic. So I'm going to ask my patient to cover their ear. Can you cover your ear for me, please? Okay, and I'm gonna go ahead and whisper. I'm gonna stand a few feet away. I'm gonna whisper something to him. He's gonna repeat it back to me. Okay?
1, 2, 3.
Correct. Other ear?
1, 2, 3.
Correct. Okay. Okay, so now I'm gonna go ahead and inspect the nose. Alright, so looking at the nose, there's no irregularities. I'm gonna go ahead and put on my gloves for this assessment. Sorry. Okay. So for this assessment, now I'm gonna go ahead and look inside the nose. I'll be looking at the mucous membranes. Okay. There's no obstruction. There's no abnormal findings like blood or anything like that. Now I'm gonna go ahead and palpate the nose. Okay. Now I'm going to go ahead and ask my patient to I'm gonna assess cranial nerve number 5 here. Oh, cranial nerve number 1. Cranial nerve number 1. I will be asking my patient to smell an object for me. Close your eyes, please, sir.
Coffee.
Yes, that was coffee. Okay. All right. Now I'm gonna go ahead and assess cranial nerve number 5 now using a cotton ball. Okay. I'm going to go ahead and ask my patient to close his eyes and I'm going to ask him where in his face that I touched with the cotton ball.
Left cheek.
Okay.
Right cheek. Forehead. Chin.
Okay, that is correct. Okay, now I'm going to go ahead and assess cranial nerve number 7, facial. I'm going to ask my patient to go ahead and wrinkle their forehead for me. Can you puff out your cheeks for me? Can you go ahead and smile for me? Great. Okay, so now I'm going to go ahead and assess the lips and the mouth. So the lips, there's no signs of dehydration. Lips are fine. Okay, I'm going to go ahead and look at the teeth. He has all his teeth. I'm going to ask my patient to open his mouth now. Okay, now I'm going to go ahead and using my tongue blade, I'm going to go ahead and use my tongue blade and I'm going to assess cranial nerve number 9 and cranial nerve number 9 I'm going to go ahead and assess for swallowing. Okay, so I'm going to ask my patient to swallow. Okay, great. Now I'm going to go ahead and assess his cranial nerve number 10, which is vagus. And for that, I'm going to go ahead and activate the reflex, okay? So I'm going to check for his reflex, okay? Okay, good. Okay, using my my tongue blade, I'm going to go ahead and assess cranial nerve number 12 on the tongue. I will be palpating the tongue with the tongue blade, checking for the muscles in the tongue. I'm going to ask my patient to push his tongue against the tongue blade. Okay, and then the left side, okay. And I'll be also checking the muscles in the tongue, which are good. Alright, so moving on to that, I'm going to go ahead and remove my gloves now. And now I'm going to go ahead and assess my patient's cranial nerve number 11, which is spinal accessory. So I'm going to ask my patient to shrug his shoulders for me as I place my hands on him. Okay? And I'm gonna place my hand on his cheek and ask him to pull, okay? Push his hand, okay, great. Okay, good. Now I'm gonna go ahead and assess my patient's neck, okay? So I will be taking a look at his neck, and then I'm gonna go ahead and palpate his lymph nodes to check if the lymph nodes are inflamed or if there are any tenderness. Okay, good. Now I'm going to go ahead and palpate the carotid artery one at a time. Okay? Now I'm going to go ahead and here use my stethoscope to osculate the carotid artery with the bell side. And before that, I will make sure to clean my stethoscope with alcohol swab and make sure it's warm for my patient. Okay, great. I did not hear any abnormal sounds in the carotid artery. Now I'm going to go ahead and assess my patient's trachea. So I'm going to go ahead and feel the trachea. Okay, then I'm going to go ahead and palpate the thyroid gland. Okay, and I'm going to ask my patient to swallow for me again. Okay, good. Then I'm going to go ahead and assess for skin turgor. Okay, good. He had good elasticity of the skin. No signs of dehydration. Okay, so now I'm going to go ahead and assess range of motion of the neck. So I'm going to ask my patient, could you go ahead and chin to your chest for me like this? Okay, chin to your shoulder, chin to your next shoulder, and then chin as far as you can. Okay, good. All right, so now I'm going to go ahead and assess his upper extremities. Okay, so I'm going to go ahead and take a look at his arms. Okay, I'm going to be looking at color, texture, if he has any scars or wounds. Okay, alright. I'll be looking at his fingers. I will be checking for any clubbing or any clubbing, and I'll check capillary refill. Capillary refill is good. Less than 3 seconds. There's no clubbing on this other hand either. I'm going to ask my patient to, can you go ahead and do this for me, please? Good. Now I'm going to go ahead and ask my patient to pull towards himself. Okay, and then pull. Oh, okay. All right, good. Now I'm going to ask you to go ahead and perform range of motion with your wrist, going like this, and like that, and then like this. Okay, that's good. So now I'm going to go ahead and feel for the brachial pulse and the radial pulse. All right, good. So moving on, I'm going to go ahead and do the I'm going to go ahead and assess the posterior thorax now. So I'm going to have my patient move. Can you go ahead and, sorry, the camera can see you. All right, there we go. Okay, so now I'm going to go ahead and inspect the posterior thorax now. So I will be looking for skin color, for the muscle mass, the shoulder blades. Okay, everything looks good. I'm gonna go ahead and palpate now. Okay, good. There was no signs of, there was no masses or any tenderness. Now I'm gonna go ahead and osculate. I'm gonna go ahead and hear his lung sounds. I'm gonna ask him to take a deep breath through his mouth for me, okay? And I will be using the diaphragm of my stethoscope. Okay, can you go ahead and take a deep breath for me, please? Okay, good. Alright, so now I'm going to go ahead and test for tactile firmitis. I'm going to go ahead and place my hands on his back. And I'm going to go ahead and ask my patient to say the word 99 for me.
99.
One more time.
99.
And one more time.
99.
One more time.
99.
Good. So now I'm going to go ahead and place my hands over his T9 and T10. And I will be looking for lung expansion. Okay, can you please take a deep breath for me, please? Okay. Great. I was able to see the lung expansion. Now I'm going to go ahead and ask my patient to sit down back to normal, facing that way. Okay. Now I'm going to go ahead and inspect the precordium. So now I'll be looking at his chest. I will be looking for skin color, if there's any irregular like pulsations that are noticeable. I will also go ahead and assess for jugular veins as well. So for the jugular veins, it will have to be 90-degree angle. So in this case, he's sitting, so it would be a little harder, but I would just go have him turn his neck a little bit, and I look to see if there's any distended jugular veins. And there's not, so that's good. So now I'm going to go ahead and, after inspecting the precordium, I'm going to go ahead and palpate the aortic. I'm going to go ahead and palpate the pulmonic, and then the Erb's point, tricuspid, and then the mitral, which is a mid-clavicular line, right? So I did not feel any irregular pulsations. So now I'm going to go ahead and listen to the heart. I will make sure that my stethoscope is warm enough for the patient. Okay, so I'm going to go ahead and start at the aortic. I'm going to ask my patient to just breathe normally for me. Okay, good. I was able to hear S1 and S2 with no irregular sounds. Now I'm going to go ahead and palpate for the lungs. Okay, now I'm going to go ahead and listen for the lungs now. Take a deep breath through your mouth. Okay, now I'm going to go ahead and ask my patient to lie down, and I will be assessing his bowels. Okay, I'm going to go ahead and inspect the abdomen, and I'll first inspect. There's no abnormalities. I'm going to go ahead and listen to his bowel sounds now, using at the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, bowel sounds were present. I'm going to go ahead and use a dipping motion to palpate. Okay, good. Now I'm going to go ahead and inspect the legs, and I'll be checking for the femoral pulse, and I'll be also hearing the femoral pulse if I were to expose my patient. In this case, I'm not going to. I'm going to go ahead and check for edema on the legs. I'm going to go ahead and take off his sock really quick, and I'm going to go ahead and check for edema, pitting edema, and the pretibial. There's no edema. I'll be checking capillary refill. Okay, capillary refill is less than 3. I'll be checking the dorsum pedis pulse, and okay, good. Now I'm going to go ahead and ask my patient to do a straight leg test for me. Straight leg, okay, the next one. Okay, now I'm going to go ahead and ask my patient to put force on my hand. Okay, more, okay, and the next one. Okay, and the next. Okay, now I'm going to go ahead and perform the Babinski sign, Babinski test on the foot, and his foot was able to curl. Okay, good. Now I'm going to go ahead and ask my patient to sit down, and I'm going to assess his tendon reflex for me. Okay. Okay, good. They were present. Okay, so now I'm going to go ahead and lower I finished my physical assessment. I'm going to go ahead and lower the bed and give the patient the call light. I will gather my equipment, put it away, wash my hands, and complete documentation. And that is it. Thank you.